Good evening. On March 3rd, a letter went out to our Temple Bethel community that, among other things, said that we would be assembling a Temple Bethel coronavirus task force comprised of staff members, lay leaders, physicians, infectious disease experts, government officials, and state healthcare workers and members of our staff. Those congregants on the front lines are taking time out of their incredibly busy lives to serve on this task force. And they serve as a place of insight and wisdom in these difficult times. It has been my dream since they began that we would get to honor this incredible committee and these incredible people. And we are thrilled that you are joining us here this evening. And now you'll meet each of our guests this evening.
Good evening, everyone. We are so grateful to the members of our COVID-19 task force and all of you for joining us here this evening. Temple Bethel is an incredibly blessed congregation. There are so many members who have so much talent and expertise and wisdom in so many diverse areas that guide our congregation and have helped to guide our congregation for many, many years, through wonderful times of prosperity and blessing and through times of turbulence and challenge. We have been able to rely on members of our congregation and the incredible professional wisdom they bring to help us move through each and every one of those moments. And so we were blessed when we faced this very challenging pandemic, that there were members of our congregation that we could call on to help guide the temple in its formation of its policies and its programming and procedures. And we are in some ways an embarrassment of riches as a congregation. And so I really want to thank all the members of the panel for joining us, and I want to introduce them to you now. The first is George Brown. George has been affiliated with Temple Bethel since 1989, when he used to serve as our accompanist and also as our choir director, our music director, and then eventually as a member of our board of trustees. Later, he became our temple's executive director and then returned to his career, which he had begun with the city of Boca Raton in 1977 as the deputy city manager, which he began in 1999. George is a proud alum of Georgetown University, where he graduated magna cum laude and also as a doctoral fellow at George Washington University. Dr. Lenny Feld is a senior healthcare executive for the past 25 years for 4 different health systems in New York, New Jersey, North Carolina, and here in Florida. He helped to open 2 separate children's hospitals and set strategy to drive healthcare outcomes, and is currently a director in healthcare strategy for Guidehouse and does his own consulting practice. He was the first president of Nicholas Children's Hospital Pediatric Specialists of America, and served as senior medical director and chief medical officer at the Levine's Children's Hospital, and has served on the board of directors of Horizon Blue Cross and Blue Shield of New Jersey, and at the NASCAR Foundation, where he has been on the board of directors. He did his medical training and pediatrics at SUNY Buffalo, and has also served and did his training at the Bronx Municipal Hospital Center and the Hospital of Albert Einstein College of Medicine in pediatric nephrology. The most important thing that you can say about Dr. Feld is that he is husband to Barbara Feld, who is one of our most popular bar and bat mitzvah tutors in our wonderful faculty. Dr. Jason Goldman is a board-certified internist and fellow at the American College of Physicians, licensed in Florida, California, Nevada, and New York. He trained at Jackson Memorial Hospital in Miami after graduating from the 6-year medical college program at the university there. He worked as a hospitalist at Mount Sinai Medical Center in Miami Beach and now is in private practice for many years in Coral Springs. He has myriad leadership positions in different hospitals and organizations, including the Florida Medical Association and the American College of Physicians. He has been governor and president of the Florida chapter of the American College of Physicians, treasurer of the Florida Medical Association, and is now president-elect of the Florida Medical Association Political Action Committee, and has served on many legislative and advocacy activities in the capitals both of Florida and around the country. And we are so grateful for all that he does as part of the faculty at Florida Atlantic University and Nova Southeastern University, and his work in genetic testing for hereditary cancer syndromes. And Rachel Guran is a registered nurse and director of epidemiology of infection prevention at the Memorial Healthcare System. She holds a master's of public health degree and has specialized experience in making healthcare safer for patients, staff, and the community. She works daily to stop the spread of infectious disease, including COVID-19. Her professional expertise is in the prevention of healthcare associated infections and outbreak investigations through identification of data-driven patterns, translating new research into clinical best practice and policy creation. You can see her dedication to health promotion through her cool music videos on hand washing and influenza vaccination. She and her husband, Johnny, who is a teacher, have been members of the Temple for many years and have two children, Benji, who is a graduate of our Early Learning Center, and Rosie, who is 2 years old and is enrolled in our ELC. We are so grateful to have you all with us tonight and are grateful that you are joining us. And so I want to ask to begin with, what is it that drew you into your various careers? How did you get there? Was it someone that inspired you? Was there anything about your childhood or your early experience in life that led you to who you are today, or who brought you on the path of life that you're following? And I'm going to ask Rachel if you'll answer first for us.
Thank you, Rabbi Dan. I would say that to be a registered nurse is a very great field. Passion brought me to it, especially how I connected with my grandparents and being able to care for them at the end of their lives. And that was the catalyst to really care for every single patient like they could be my family members.
That's great. And Dr. Goldman, I think you're next.
Thank you. Well, I have just always wanted to help people, just something innate within me since I was a child. And my grandfather always wanted to be a doctor, but never had the opportunity, and had always looked up to him. And just growing up, hearing stories about selflessness, sacrifice, service, and how we can help our fellow man drew me to the calling of medicine, and have always wanted to do that ever since I was a child.
Thank you. And George, what drew you to public service?
I think it was probably the fact that both of my parents were teachers, and it's helping others. And it just through public service was an accident. Being in government was actually an accident. But I found that I really enjoyed the fact that you're able to accomplish things for people, to help others get things done for people. That's what my work is.
Thank you. And Dr. Feld.
Well, first of all, thank you for having me. I've always wanted to be a physician. I think I bonded very well with my first pediatrician, and we actually remained friends for probably 30 to 40 years until he passed away. The other thing that inspired me is when I was in college, one of my professors grabbed a hold of me and says, I think you need to do some research. I think you'd be good at that. And I think that drove me for many years to come.
That's great. And on to Rabbi Mates.
The next question. So what in your career is most rewarding? And we'll start with Dr. Goldman there. What in your career is most rewarding?
So part of my career is advocacy, helping others, obviously taking care of the patients, being able to make sure that I'm keeping them healthy and preventing disease. But on a more global scale, I've been allowed to, through organized medicine, have opportunities to interact with members of Congress, state legislature, and I even sit at the work group at the CDC for the COVID task force, advising the advisory committee. And it's just rewarding that I've had all these opportunities to be involved in really advocating, legislating, changing the course of the country on healthcare to try and improve it for all of us.
Thank you. Dr. Feld, what is rewarding?
Well, I think that my entire career has been rewarding. I think I started out as a pediatric kidney specialist dealing with children that had kidney failure that needed dialysis transplant. And what was rewarding about that is being able to bring those children to having a reasonably normal life. And even today, some of those children that are now adults in their 40s still contact me and let me know how they're doing and asking for occasional advice, which I think really stimulates me to continue working. I made a transition to building two children's hospital and becoming much more administratively rather than clinical. And where I got a lot of rewards by that is by hiring hundreds of physicians to provide improved care to large communities, whether it was in Charlotte or New Jersey or in Miami. And that has been extremely pleasurable experience for me over those last 35 years.
Great. Rachel, what in your career is most rewarding?
As a public health professional, getting to affect large group changes. So my work in the hospital, preventing hospital-acquired infections, seeing how right now for COVID-19, how the decisions we make protects our healthcare workers. We have had very little, almost no healthcare workers become positive with COVID-19 from the hospital care. And that's in direct relation to the infection control, infection prevention that every single team member all across the hospital embodies every single day.
Fantastic. Thank you. And George, what is
Well,
rewarding?
my government work is certainly not exciting. If I were to describe to you all what I do every day, you'd fall asleep within maybe a minute. But what's rewarding about it is we are able to solve problems for individuals, groups, and the community at large. And we're able to create policy that helps move the city, keeps the city as good as it is and helps it move forward. And we're able to facilitate good things happening in the community through our processes, and all of that is an example, the redevelopment of the Schaefer campus at Bethel.
I'm going to ask a follow-up question in the same order. What has been the most challenging element in your career, and how does this time of COVID-19 reaffirm the rewards and the challenges? And same order, we'll go Dr. Goldman, then Dr. Feld, and Rachel, then George.
That's a good question. The biggest challenge has always been forces beyond our control. You know, I want to come in every day, take care of patients, make them better, improve their lives. But when you deal with politics and when you deal with government and regulations and legislative issues, and people trying to tell us how to best practice medicine when not even being in the field, is the most difficult because it prevents us and interferes with that relationship we have with the patient. And we see it now with COVID-19 and what's going on nationally as well as locally, and decisions that are being made, not necessarily based on the science, the doctors, the medical community, but on politics and other forces. So that's been really the most difficult, is interference by government and other agencies and what should be the sacred relationship between the doctor and the patient.
Thank you. Thank you, Dr. Feld.
I think I come from it from two different ways. On one hand, being a clinician of dealing with children that have kidney failure, the difficult part is when a family comes to see you, and I think this is very applicable to the COVID crisis as well, is they've generally been healthy. And for the first time, they've never even knew that they had any kidney involvement. You're telling them that they're going to need dialysis or transplant in the future. And one of the things that I've learned over time, and I think we're seeing this with COVID also, you're mourning a death of a well child or a well adult. And I think that's very taxing on people. And I think that drives you to tears in many times when you have that. And it certainly did for me when I was practicing full time. The other part of it is the challenge is when you know you have a good idea and it's hard to move it. And telemedicine, telehealth, I started that about 10 years ago in Charlotte for critical care, hospital medicine, and neonatology. And at that time, everybody thought we were crazy, that this was never going to catch on, had no value in society. And today, you can see how meaningful that's been in improving the care and the health of many patients and preventing them from having serious catastrophes from the COVID infection.
Thank you. Rachel.
I would say one of the greatest challenges is the misinformation that's out there. The anti-vaccination community has taken hold of the world, and now that's fueled by people who are spreading misinformation on Facebook and people who think that this is a hoax. All of that plays into the way that the public now sees healthcare and then won't trust, the healthcare professionals, and that's a very big challenge.
Thank you. And George.
Am I unmuted now?
You're muted. Yeah, you're good.
Great. As Dr. Goldman mentioned, things beyond one's control are the most challenging. And I would think that for us in the city, it's probably up until COVID, we had the anthrax issue and hurricanes. And those things, are the anthrax issue and COVID were unprecedented. Hurricanes are precedented, but there are a really difficult time. The hard part about it is not being able to help people in situations. For example, we don't control Florida Power and Light, but they're the most important element in a hurricane, in hurricane recovery. And very often it's very difficult to explain to folks, we can't just make them come fix your problem. That is a challenge. It's also rewarding to be able to work through those things and get them done for folks.
Thank you. We'll go to Rabbi Levin for the next question.
Sorry. That is a Zoom foul when you don't mute yourself in a timely fashion. I would like to ask, I'm sure that this time, as you've been navigating all of the challenges that we've faced in this crisis, I'm sure it's been just really taxing on all of you in the different ways that you find yourself working through this difficult time. And so I kind of wanted to ask, who are your heroes? Who are the people that you look to for inspiration and hope? What are you reading that's giving you some edification? Who are your rocks? What is it that's helping give you a sense of strength and spiritual renewal through what you're having to accomplish? And George, I'll ask you maybe to go first.
Okay, well, as far as my heroes, it has to be my father, who will be 95 years old on July 1st. He is in perfect health. He lives in an assisted living facility where there are no cases and have been none since the very beginning. He's just wonderful. He does so well. He is so grounded spiritually to this day that it's a model for me about that you can get through anything. My father has been through so much in his life, and you can get through anything calmly with grace and a good sense of humor. In addition to that, most of you know I'm very grounded in music, and music has been a source of solace for me during this time. When I have the time to listen to music or play the piano, it relieves all the tension. Everything goes back into where it needs to be.
George, is there one piece that if we wanted to find that place, what should we be putting on our own music playlists right now?
I would suggest that everyone listen to a symphony by Beethoven. Choose whichever one you want. Timeless classic. No, there are no underlying issues with Beethoven that would cause people to question whether or not it's appropriate to listen to his music, that sort of thing. I would encourage Beethoven, Mozart, Brahms. We can go on, and I will go on.
That's great. Thanks, George. Dr. Feld.
As far as what I'm reading, it's your recommendation, Death of Expertise. I find that is an amazing read today, and I recommend people should, because it really shows how we have a lot of unbelievable heroes taking care of patients across the spectrum. And this is probably one of the early times when they are respected for what they've done, because in many years going back, patients never said thank you. It was something that was rarely put forward. And seeing everybody saying thank you to the workers and the doctors, I'm sure Dr. Goldman has had the same experience. You go in, you save somebody's life, you walk out, and you have to turn around and say, you're welcome. And today they now really appreciate what people have done and what people have gone through, and they see that people have sacrificed their lives. And the death of expertise, we see that every day now with Dr. Fauci and others in the medical area that are espousing what we should be doing and how it's being ignored. So I think it's a very tough time, but I strongly agree with the rabbi, and I thank you, Dan, that Death of Expertise is a great read, and I certainly recommend it. And what I'm trying to do is inspire now, so my wife and I can go back and see our grandkids and our kids sometime this summer, since we've been sort of in quarantine from them.
I can imagine that must be really difficult, very difficult indeed. But I appreciate the plug for that interesting book. I found it to be really edifying myself. Rachel, what would you say? Who are your heroes? Who are you looking to? How do you restore yourself, especially being right there on the front line in the hospital?
This is a very easy question, Rabbi Dan. My hero is my husband, Johnny. He's a teacher. Right now, he is teaching his students online. And then he's also teaching our 7-year-old online and our 2-year-old every single day, every minute of the day, while I have to be at the hospital and on the phone calls, and never begrudging anything. So I turn to him, and he always has a smile on his face, and that brings me so much joy and happiness. I did get away a little bit mentally this weekend. I stopped reading the medical journals, and I picked up the new Margaret Atwood book, The Testaments. Let me dream that life there could be worse than it is now. And it did have a happy ending, so I was happy about that. And like George, again, we're listening to a lot of music. We're watching some live concerts, videos of live concerts, wishing that we were back there and realizing we won't be there for another couple of years, and that's going to be our new normal.
So what concerts were you watching?
We watched a music festival called Shaky Knees. We got to see some Car Seat Headrest and Portugal the Man and Tame Impala sets. So we were having a good time in our house listening to good festival music.
Yeah, almost as well known as Brahms and Beethoven, but not quite. And Dr. Goldman, who are you looking to as your heroes? What are you reading, and what are you doing for inspiration?
So a three-part question. Obviously, my inspiration, my strength, of course, my family. That goes without saying. Without them, without family, there's really not much that we have left. As far as how we cope, it's the little things. It's trying to appreciate those small moments spent together, walking around outside, taking a bike ride together, the little things to remind ourselves of that connection. Reading, haven't had much time with work and everything else, and trying to keep things going. Have been on multiple conference calls, both locally and nationally, so I haven't really, unfortunately, had time to read, because I do love to read. But as far as inspiration, I think many of us may suffer from imposter syndrome and think we're just not doing enough. And I look at what my colleagues are doing in the emergency rooms. I see what's happening in New York. I look at the first responders who are, in the field. And even though I'm seeing the coronavirus patients, I'm testing them, I have to gear up with the PPEs, I'm seeing them in my office, I never feel I'm doing enough. I always feel that there could be more that all of us could be doing. So I really look at the essential workers and the ones who are in the emergency rooms, the ICUs, New York, and the places hit the hardest. And I say, well, if it could always be so much worse, and as bad as we think it is, someone else may have it much worse. And so that inspires me to keep doing what we need to do, because what's put in front of us is not more than we can handle, because if other people can handle it, we certainly can.
Thank you so much. So I want to bring it to your work you're doing with more than yourselves. You have their other congregants and other staff people on the COVID task force. So the question I want to end with is, what has it meant for you to be on Temple Bethel's COVID task force, and what has been meaningful to you through this? And we'll start with Dr. Feld.
Well, first of all, I think it's an amazing group, and I want to just give a shout out to Steve Kaufman and the entire team that's done this, because putting the meetings together, but all the work that they've done beforehand has really driven protecting the youngest of our congregations to the oldest. And I think that attention to detail has been amazing. Also, the group, as you've seen, is very diverse. They've been amazingly thoughtful, and all of them uniformly have done this because we all care about Temple Bethel. I've sort of seen it from my wife's point of view of all the teaching that she does, but now I've seen it firsthand about how amazing the group is, how they care, and how they put their congregants as number one. So it's been a pleasure to serve, and I'm deeply appreciative of being part of it, and appreciate the team of the Temple that's really spent a lot of time on this crisis.
Thank you. That's beautiful. George.
I was really happy to be asked to join the task force to be able to connect the city to Temple in this crisis, so that we were able to work together, share the information. In the early days, I was able to provide some information about where things appeared to be going that I think were helpful. I agree with Dr. Feld that Steve and the task force team have put together great work all along. There's been very little redirecting, I think, that needed to happen based upon their research and the work that they did, and especially with the advice from our medical professionals in the beginning. Protection of the congregation was paramount. I think all the decisions that were made were the right ones, and they were made early, which was very important to our ongoing health as a congregation. And again, it shows what kind of Temple family we have, that everyone's ready to come to the table and make things happen.
And George, you've been there such a long time. You're part of that foundation. Absolutely. Thank you. Dr. Goldman.
And so it really has been a wonderful experience. I can't say enough about the team. They've been excellent, supportive, pleasure to work with. Everyone's been respectful, have listened, and I think we've made some really good decisions and good recommendations to protect our community. You know, it really is meaningful because you go back to the old expression, you save one life, you save the world. You know, we're doing good work trying to keep our community together, because if we don't all work together, no one's going to do it for us. So it really has been very meaningful to me to be part of this, that I can give back in whatever way possible in helping to make sure that we all continue to get through this crisis as quickly and safely as possible.
Oh my God, my heart, you're all so, we can't thank you enough for you to speak this way. It's unbelievable. And finally, Rachel, this will be our last question. What has it meant to you to be on Bethel's COVID task force, and what has been meaningful to you through this?
I'm so happy that I get to share my expertise in preventing infection with the Temple, with my colleagues, and with my friends who I've made from the Temple for many years, as well as the wonderful people, who have made masks for all of the healthcare workers and all of the patients. Linda Frost for organizing that was amazing. We were one of the first hospitals to be able to offer masks that now you see are mandatory everywhere. And we were able to give them to our mothers coming to deliver their babies. And it's just a wonderful thing for all of our patients who have had to continue to use the healthcare facilities during this crisis. So thank you.
Thank you all so very, very much. I'm just really grateful to all of you for being here with us. And since we have a little bit of extra time, I'm going to actually ask your indulgence to join me for a special prayer that we want to offer for you, for those of you who are on the front lines with us and who are giving so much effort to help not only support the broader community, but specifically our congregational community with your time and your talent and your wisdom and your experience and expertise. And so if you are at home, I will ask you to please join me in this prayer for our healers. May the one who blessed our ancestors bless all those who put themselves at risk to care for the sick. Physicians and nurses and physician assistants, technicians and home health aides, EMTs and pharmacists, hospital social workers and respiratory therapists, administrators who work so diligently to procure life-saving supplies, those who mop and clean and sanitize, and those laboring in laboratories to find therapies and vaccine, who navigate the unfolding dangers of the world each day to tend to those they have sworn to help. Bless them in their coming home and bless them in their going out. Ease their fear and sustain them. Source of all breath, healer of all beings, protect them and restore their hope. Strengthen them that they may bring strength. Keep them in health that they may bring healing. Help them know again a time when they can breathe without fear. Bless the sacred work of their hands. May this plague pass from among us speedily, and in our days. And let us all say, Amen. And so we are just so grateful to our panelists. Tomorrow night, I'd like to invite anybody who is serving as a first responder or a healthcare worker, or those who are trying to render aid to our community on the front lines, as those who battle this terrible pandemic, and those who are healthcare workers and are finding their response in various different ways, to join our cantorial soloist Michelle Ostlander-Cohen and myself tomorrow night at 8 p.m. for a gathering for support and spiritual guidance from our tradition, and to have a chance to commiserate and to gain collective strength from each other. You're welcome to visit the temple's website, www.tbeboca.org. You can register and receive that Zoom link. We hope that you will join us. We had a wonderful gathering several weeks ago and look forward to our next gathering. I really do want to thank George and Len and Jason and Rachel. A very special thank you to Amanda Brenzel and Ross Glinkenhaus, who are our wonderful producers, along with my partner in crime, Rabbi Mates. And many thanks to Aileen Spilka also for her help in this presentation, and also Critter Invasion Lawn Sign Company, that is doing so much to bring a sense of happiness and cheer to so many who can't get out for graduations or special occasions, and they come to you and present a wonderful bit of love on your front lawn. So we're so grateful to have everybody. And again, we want to just say to everyone in our congregation, we hope that you will stay safe. We hope that you will do your best to abide by these difficult and challenging guidelines that we've all been asked to follow. If you find yourself in crisis, if you find that you don't have security when it comes to your own supplies at home or for food, or you're feeling an intense sense of loneliness and need some spiritual and emotional help, please don't hesitate to reach out to Temple Bethel. You can always call the temple 561-391-8900, and we will call you back as soon as possible, or you can send us emails, find our emails on the website, and enjoy all the incredible ways Virtual Bethel offers for you to be able to reach out and to find a sense of community and learning with each other. There's opportunities to gather with members of the clergy each week for our clergy chats. You can learn Hebrew. You can learn tomorrow morning, 10 a.m., about the history of Menachem Begin, Prime Minister of Israel. Join us for Friday night services at 7:30 through our live stream. Study Torah with us or take some of our classes. So many ways for you to connect to Temple Bethel. We thank you all so much for joining with us, and we hope our evening with our COVID-19 task force helps you to see the incredible selflessness with which members of our congregation are contributing to help our community. Have a wonderful evening, everyone.